Assalamu alaikum, everyone. Can you guys hear me?
Walaikum assalam. Yes, we can hear you.
Perfect. Thank you so much for joining. This is going to be a combined presentation by me and Abir. I'll have Abir go ahead and give a little bit of an introduction.
Hi, I'm Abir Ahmed. I'm a podiatrist at the Neighborhood Health Center, which is a federally qualified health center in Buffalo, New York. I work with a lot of Muslim and refugee patients. So this talk is pretty relevant for me, and hopefully it's relevant for you as well, inshallah.
My name is Arwa Akram. I went for Hajj last year with my husband and my mom, and I'm also a podiatrist. I work at a federal agency in Indianapolis, Indiana. So both of us went to Hajj last year, so we have that personal and the professional experience. We'll keep the presentation short to just under 30 minutes, and then we'll leave the second half for any question and answers. So you guys can feel free to type your questions as you come along, or you can wait till the end of the presentation.
Okay, let's get started. Okay, so just going over some goals of this presentation. So if you're any mom or a scholar, it may be good to know some of these stats just to help your community prepare for Hajj. If you're lowering their risk for injury, they'll have more time for ibadah, inshallah. If you're a medical professional, whether you're Muslim or you're non-Muslim, just knowing the risk factors for lower extremity complications would be helpful, and it'll allow you to provide medical and lifestyle recommendations for your Muslim patients. And then if you're a Muslim physician, just knowing all of this information will help you guide your patients and your community. Next slide. Okay. So just some background on Hajj. I actually personally didn't know a lot of the rituals of Hajj until I literally went last year. But Hajj is Arabic for pilgrimage. On average, about 2 to 3 million Muslims perform Hajj a year. And this happens once a year in Mecca. In 2024, the year that Arwa and I went, it was 1.8 million Muslims. This is a requirement for every Muslim, at least once in their lifetime. And Hajj is performed over 5 to 7 days and requires a lot of walking. So it can be anywhere from 3 to 9 miles a day. And it also depends on how far your tent is from Jamarat, which we'll go over a little bit later too. In total, you're on your feet for about 40 miles in Hajj. And this picture, kind of goes over just really briefly some of the rituals of Hajj. And then as far as Umrah goes, it's a little bit less of a pilgrimage. It's basically the first 3 steps. Alrighty. Next slide. Okay, so this is a satellite image of all of the sites of Hajj. And you can kind of see like how far everything is from each other. But realistically, just in my own experience, you may not like end up walking to every single one of these sites. Personally, I had a shuttle from Mina to Arafah and then also Arafah to Muzdalifah. Muzdalifah night specifically, I ended up getting kind of sick. So I got a shuttle from Muzdalifah back to Mina, but the shuttles were kind of limited to those that were sick or elderly. So like, for example, my husband did not get a shuttle from Muzdalifah back to Mina. I guess the point is just that with Hajj in general, it's a little bit of a coin toss whether you're going to get a shuttle or not get a shuttle. So I think just be mentally prepared to walk and then hope that, it's not as much walking as maybe you initially thought. But that's just kind of the nature of Hajj in general. All right, next slide. Did we switch this screen share or something? Should I pause for a sec? Okay. So for Tawaf, that's circumambulation around the Kaaba 7 times, and it requires about 1 to 3 miles of walking. This statistic is for the ground floor. So the closer you get to the Kaaba, it is a shorter distance, but it can increase your risk for injury because it's very crowded in that area and people tend to get a bit aggressive. So that's definitely something to keep in mind for Tawaf. Next slide. Okay, so for Sa'i, This is going in between Safa and Marwa 7 times, and that total is about 1.7 miles. Just a personal pro tip for Safa and Marwa, if you go to the second floor, it's actually a lot less crowded and it doesn't have an incline, so it's a little bit easier to do. So that's something to definitely keep in mind. Next slide. So for me personally, you know, like I said, I had shuttles between a lot of the sites, but this is where I did my majority of walking. So that was to Jamarat. You're doing about 3 round trips from Mina to Jamarat over a total of 3 days. And it averages about 20 miles. Again, this is really dependent on where your tent is in Mina. So when people opt for closer tents, this is, you know, what they're talking about. It's your proximity to Jamarat that really matters. And it can be a little physically demanding because, you know, you're walking in the hot sun, and that back and forth to Jamarat can be quite long. My tent personally was pretty far away from where Jamarat was, so I ended up taking, just walking for me ended up taking about a 3-hour like round trip. I would personally recommend trying to get a Major Al Qabsh tent. Those are the closest North American tents to Jamarat. The year that I went, or as far as I know, there were no shuttles in Mina. So like for a lot of people, this is kind of like where you're doing the majority of your walking. I don't know if that's changed or it will change in the following years, but for me, I never really had an access to a shuttle like within Mina to Jamarat. Okay, so alrighty. So just getting a little bit into the fiqh of what shoes you should be wearing during Hajj. Typically, Muslims cannot wear shoes or sandals inside any masjid. And you know, several of these rituals were performed in Masjid Haram in Mecca. So for Masjid Haram specifically, it is recommended that Muslims wear sandals during the pilgrimage, according to this hadith, Musnad of Ahmed 8500. In our group specifically, we had a lot of people bring like a brand new pair of shoes with them. And then they wore those shoes for the very first time in Masjid al-Haram. So that way you don't have to feel like weird about wearing shoes in the masjid. For females, they can wear socks with closed-toed shoes, open-toed shoes, or sandals during the pilgrimage. Whereas for males, there's a bit of a difference in opinion, but the majority opinion is that their ankle bones and the upper and middle part of their foot should be uncovered, which is kind of what's colored in over here. Next slide. Okay. So here we have some examples of sandals. You know, again, females can kind of wear whatever they want, whereas for males, some of your foot and ankle bones, you know, should be uncovered, like the upper and middle part of your feet. So for footwear options, from what I saw, like men are typically wearing, you know, shoes that are similar to number 1, and those leave the foot and ankle bones uncovered, whereas like 2, 3, and 4, these are kind of like gray area of like whether you can wear these kind of shoes or not. Next slide. Okay, so what if I have painful feet? So to address these questions, if you have to wear shoes that don't meet the conditions of Ihram due to medical reasons, it is possible that you may have to pay a fidya, which is a religious donation. And then if you, let's say, have to use an assisted device or wear shoes that don't wear, like which one would be better? Using an assisted device or wearing shoes that don't meet the criteria for Ihram? This is something that should be addressed like on a case-by-case basis. For me, what I consider high risk is someone who is at risk for a foot ulcer, or maybe, you know, if you had a history of amputation already. So if your podiatrist is recommending that you use an assisted device during Hajj, you know, it's also really important that you ask a trusted scholar in your community. I know I went over a little bit of the fiqh of like what types of shoes to wear for men and women, but I'm not a scholar in Islam. So, you know, of course, it's like best to check with a scholar before like proceeding and actually wearing these shoes. Okay, next slide. So this is just like a point that I thought was interesting. The Kaaba is made of Thasos marble, which reflects heat and stays pretty cool. So hopefully, inshallah, this will make your journey a little bit easier. And then, you know, before I hand it over to Arwa, just some of my own personal recommendations. I would say try to start walking daily. in the days leading up to Hajj. This is like advice that everyone will kind of give you, but for me, I wish I did a lot more of this because even like it was so physically demanding. And I feel like I just wish I did a little bit more of like the prep for Hajj, like in terms of walking, because I didn't expect to be walking as much as we did. And then this is not podiatry related, but just another personal recommendation. I personally watched a lot of lectures when I was going for Hajj about the spirituality of Hajj. And I think that I wish that I studied the logistics of Hajj a little bit better. We did have access to a scholar. You know, every group should be assigned a scholar, usually with all of these agencies that you go with. Like I personally went with Darul Salam. So we had access to a scholar, but every time I needed to ask a question, I would have to ask through the reps. So sometimes there was a little bit of a delay in answer. So I wish that like maybe I knew the logistics myself a little bit better than I did. So when you are watching lectures and prepping for Hajj, yes, focus on the spirituality, but also focus on the logistics of Hajj. And that's it for me.
Okay, thank you, Abir.
Yeah, for sure.
I'm going to go into some of the common ailment or problems that you may be experiencing right now or something that can come up during Hajj. The most common one I want to start with is called plantar fasciitis. It can also be referred to as heel pain or bone spurs. So this typically presents as pain at the bottom of the heel when you take that first step in the morning. After you walk a few steps, it may feel a little bit better, but if you have been sitting a while, it may come back. For some people, if they walk a lot, they could be dealing with it constantly. So this occurs because of this ligament that's shown in the center of the image. It could become tight and put some pressure on these areas. For anyone that's doing a lot of walking or standing, this can be caused. And then wearing shoes that doesn't have enough arch support can aggravate the condition as well. The risk factors, most common people that are affected by this are going to be women between the ages of 40 and 60, anyone that's overweight, if you walk barefoot a lot, if you have the either extremes, either if you have flat feet or very high arches, if you have very tight calf muscles, and if you're in pregnancy the last trimester. So now the treatment really depends on the severity. I would say if this is something you're dealing with right now, I would urge you to see a podiatrist before you travel. If you need a steroid injection or something a little bit more aggressive, this would be the time to do it. If this is something, you may have experienced once or twice on a vacation when you walked a lot, then I feel like it's something to be really cognizant of now and be well prepared in case this does come up during your travel. So if you start to be experiencing that heel pain, it's better to start treatment right away. The longer you wait, the worse it's going to get. You need to rest it, icing it, and stretching. That's your triad, basically. Taking a water bottle and rolling it on the bottom of your arch or the bottom of the foot. As Abir mentioned, walking is super important to start now. So if you're already doing a walking regimen, make sure you include your calf stretches and then taking care of the bottom of the feet right now. Wearing some inserts, which I have some examples up on the next slide. Taking some anti-inflammatory. So, let's say you wake up Mina day 2 and you have that intense heel pain. Make sure you load up on some NSAIDs then just to calm down that inflammation and make sure you're not staying in that high inflammatory state. And some of the other stuff would be more aggressive treatment. The 2 stretching exercises that I have on the side are pretty simple. You can do them anywhere and they're really helpful. The first one is just hanging the back of the heels down anytime there is a step or a little bit of an incline, and just staying there for about 20 seconds, whatever you can tolerate. You can do these as many times during the day as you can, and then just anytime you see a high inclined surface, just drop the back of the heels down. It's called eccentric lengthening. And the other one is taking a towel or a belt or something and just grabbing your foot and then bringing that towards you. When you're doing that, the most important thing is to make sure your knee is extended, because if your knee is bent, you're not really getting as good of a stretch as you would otherwise. These are some of the helpful items that can help with plantar fasciitis. Power step inserts. So if you already have some good shoes, but they just are lacking a little bit of that support, you can replace your current insoles with these. You can get them on Amazon. And I do have the link for all of these things at the end of the presentation, which we will share. So that's one thing. Gels. So this is really good for elderly folks because as you get older, you lose a lot of like fat pad and cushioning on the bottom of the feet. or for women, if you're really skinny, you just don't have a lot of cushioning on the bottom of the heel, this is something you could put in your shoes. I have a few example of sandals for men. It doesn't really matter what brand you get. I have some Ufus and some Kulu shoes here, but basically you really want that arch support in there, and also just a really good sturdy shoe. Like if you bend it, it shouldn't be too flimsy. For women, I honestly, so I took a pair of sandals, but I wore my tennis shoes as much as I could. So I have some Asics here, some Hokas, because when you're wearing sandals, your toes are going to be gripping the ground, and that really hurts, especially if you're walking, 15, 20,000 steps a day. At the end of that day, your toes are going to be cramping, they're going to be painful. So having that extra support in terms of like a tennis shoe is beneficial, even for men outside of the Haram days. So, if you're there for Hajj, your package is for 10, 15 days. Outside of those 3-4 days, whatever, you can wear tennis shoes. So make sure you just have some good shoes with you. I would recommend having, at least break a shoe in about a month before you go, because wearing new shoes and then walking, 20,000 steps, you're definitely going to get blisters, which is not going to be nice. Another common condition that some folks can have is called metatarsalgia or neuroma. So this is described as like pain in the ball of the foot. So sort of in that area, you can see in the picture. This is more common in people who have high arch feet. Again, if this is something you're currently dealing with, please go see a podiatrist now. But if this is something that has flared up maybe once or twice in the past, you can buy these metatarsal pads. So these pads, they're on Amazon. You put them behind the ball of the foot. So let me see if I can. So this is the ball of the foot here. Make sure you put that little pad sort of in this area, because if you put it directly where the pain is, that's not going to help you any. Some people can also develop something called a neuroma, which is basically nerve irritation that goes in between the toes. This little pad can help with that too. Again, this is sort of the temporary treatment along with the resting, the icing, and taking the NSAIDs as necessary. Some other item recommendations. Let me see if I can remove this. Okay. So other item recommendations, the urea cream is really good if you already have very dry, cracked skin, especially those patients that are diabetic. This can help keep the feet, from preventing any cracks or breaks in the skin. Wearing compression socks, especially on the flight, I think everyone should be wearing compression socks. And then after that, it just depends on you. For some people, if you do get a lot of swelling, I would recommend wearing them throughout the day. Something lighter, 10 to 15 is, a little bit easier to tolerate throughout the day. But for, if you have an elderly parent that has a lot of swelling, then wearing something a little bit on the higher end would be better for them. For compression socks, you put them on first thing in the morning. So, you do your wudu, you can put your socks on, and then you take them off before you go to bed. It's not helpful if you do it any other way. The anti-chafe balm, the Body Glide, it works really well for all other areas of the body, but especially the feet too. So, to prevent irritation around the toes. For men, even between that first and second toe, when you're wearing your sandals, you can prevent some blistering there in that area. If you have hammer toes or any calluses on your toes specifically, you can buy these toe sleeve protectors that can be helpful. If you're prone to getting, blisters on the back of the heel, especially if your shoes are not broken in enough, having something protective there can help. And then having an ankle brace, again, if you currently have a sprain or something going on with your ankle, please see a podiatrist before going. But if this is something that, you are prone to getting twisting injuries of the ankle, it wouldn't be a bad idea to have a soft ankle brace in your luggage. So diabetic foot, out of anything in this presentation, I think the diabetic foot would be probably the most important. So if that's you or a parent or, a relative that does have diabetes, it's super important they see a provider before they go on Hajj so they can have a proper foot check. Something that can develop in patients with diabetes is called neuropathy. That's where their nerves can get damaged. So they may step on something and not realize that they, caused themselves a cut or a bruise or whatever. They may also have some poor circulation, and all of these factors can lead to ulcers and amputations. This is something us podiatrists see every single day. So, you could think, oh, no, not me. it's literally the story every single day. So just some of the common caring habits you can do for these patients. I would say make sure you wash your feet and dry them really well, especially in between your toes as well. Applying moisturizer at least 2 to 3 times a day, because these patients are more prone to drying of the skin. So that would be helpful. Just checking your feet, make sure you didn't develop a cut or a blister, because that left untreated can cause a lot of problems. So, any small injury in like a young, healthy patient is not as, you don't have to worry about it as much compared to a diabetic patient. Make sure the nails are nice and trimmed, no sharp edges before you go. Always wear socks. Don't walk barefoot. So you, like Abir mentioned, having like a clean set pair of shoes, or even the groupie socks at least, for the harm. You can wear shoes inside. And then for women too, you are allowed, especially like on the second and the third floors, you can wear shoes. So make sure you bring in a clean pair of shoes with you. I would say even if you have been wearing them, just washing them, really good before you come, that's fine too. And then just checking your shoes before you put them back on. Make sure there's no rocks or anything that's been left behind. Just again, because if you don't have the best sensation, you may not feel all of these things. I have a few studies. I'll just briefly mention that all the stuff that we're talking about, it is seen every day during Hajj. So this study done in 2023 showed that the lower extremity was the most common site that had trauma in Hajj. For diabetic patients, they were the ones who had the most common foot injuries, about 71% of them. And initially, they just present as redness and blister. Another big problem is non-compliance. So, you may see, hey, I got a small bruise. Don't worry about it. But that can cause a lot of problems, again, for diabetic patients specifically. So make sure, if there is a camp physician, you see them, you have a consultation before Hajj, after Hajj, just stay on top of your health. Another study that showed that blisters are very common in women and anyone that's overweight and obese. Foot twisting or ankle sprains are higher in Arafat. I think that doesn't apply to us as much anymore because most of us are going to be in the tents and not really climbing the mountain. But more so for it says the Egyptian nationality. They are generally out walking a lot. Their camps are a lot further, so they can have more complications with their feet. This study showed that there is a higher prevalence of falls in older pilgrims and in women versus men. So just some safety recommendations. Again, the biggest thing I think both Abir and I would say is make sure your shoes are well fitted, well broken in before you go. Either if they're too small or too tight, both of them can cause problems. And outside of Ihram, men can wear supportive shoes. So please make sure you're not just taking one pair of slippers for the whole journey. For women, make sure you have socks pretty much all time. I had sandals and my tennis shoes. Because the heat is so intense, with it being like 130 degrees outside, it doesn't feel any better not having shoes and socks on. So I would personally just wear those as much as you can. Make sure you're washing them and then putting a good moisturizer on. Like Abir mentioned, please don't go from a sedentary lifestyle to attending Hajj. We're young and healthy, and even then it was very physically strenuous. So anyone that has even light like if you have elderly parents that are going with you or whatever the case may be, Hajj is very strenuous, so please be mindful of that. And then seek care before, during, and after Hajj. This is the item list of everything that I shared. These are direct links, so again, I'll share this at the end of the presentation so you guys have access to this. And that's everything. We will open up the floor now to questions for Abir and I. Any questions, concerns that you guys may have? Go ahead, Nida. You could
Jazakallah
just
khair
unmute
both.
yourself.
This was amazing. Thank you, Jazakallah khair. I just had a quick question up with regards to arthritis. I've got arthritis in the two front, the right foot on the two main toes, and it goes into kind of the top right quadrant. What's your best recommendation? I do have the best shoes I could find, but in terms of walking, standing, sitting, stretching.
For first joint arthritis, I personally do corticosteroid injections into the joint. Obviously I haven't seen an x-ray for your foot, but that's something that you can kind of ask your podiatrist about. For me, when I've done the first joint corticosteroid injections, a lot of my patients feel relief for 6 months to a year. So that's something that I would say consider.
I completely agree. If you're already having this problem, I would say see a podiatrist now, get that injection just so you're pain-free during Hajj. The other over-the-counter stuff, Voltaren gel, it's something we took it with us, but we weren't sure if that was, permissible because of the smell. So we didn't apply it, but that's something you can use for general arthritic pain as well. I hope that answers the question.
Yeah, Jazakumullah khair.
Sabiha, go ahead.
Alaikum. So does Voltaren gel also help with heel pain?
It can a little bit. It is an anti-inflammatory, so like how you take ibuprofen by mouth, it's that in a topical form. So it can help a little bit. But I would say, if you're having heel pain, probably taking the pills, maybe like an 800 of ibuprofen is going to be more strong than just the Voltaren gel. But again, if this is something you're having right now, getting an actual steroid injection is going to be better than doing some of these other things.
So I did get one last week. Alhamdulillah, it really decreased it because, I started walking to be prepared and it big flare up. So it's my first time. So I would say 90% is gone. Should I get a second injection and also I can't eat ibuprofen anymore because it upsets my stomach. So is there something else?
I would say wait maybe another week or so and be really aggressive with stretching and icing. And if you feel like it's starting to, still be flared up, it's not a bad idea to get another injection. If you're doing them 3 weeks apart, that's totally fine. Do you have anything?
Yeah,
So-
I agree.
Sorry.
I would say maybe wait another week and get an injection a little bit closer to Hajj. And then something else that's useful for that kind of pain, you can get a night splint, which kind of is passive stretching. So you don't have to really think about maybe doing the stretching exercises. Because I know that 4 times, they're recommended that you do them about 4 times a day. But if you aren't finding time to do that, just we can even link this, I guess. But if you Google night splint, plantar fasciitis on Amazon, they have some pretty good options and it'll allow you to passively stretch.
So I
Um,
have,
yeah.
they do get warped and then start digging into your, the metal is hard to reshape it after a while. I don't know if if there's a brand you recommend for night splints.
So the one that I usually go for, it's just very, I'm not sure if this is the one that you're talking about, but it kind of almost looks like a cam boot. It's a very sturdy, it's not the cloth one. It's not the one that just has straps. I'll link the exact one, but yeah, I do have a recommendation on one that I feel for my patients have been working well.
Okay, and is
I
it
can put
okay?
it in the comments.
Yeah, let me put it there.
Sorry, I don't want to hog up the whole time, but my last question is, I have an appointment 4 days before going, so getting a shot then is okay?
How have you been doing in the past when you've gotten the shots? About how many days would you say it takes for you to take into effect?
So I got one on Thursday and today is Sunday. And so like I said, 95% feels gone, but just I can still kind of feel it.
Okay, I would say maybe a week should be okay. It's really different for everyone, so it's hard to give a general recommendation, but I would say a week should be okay. If it's Thursday and Sunday, so that's what 4 days. Yeah, I think a week should be fine. And you said you're seeing your podiatrist 4 days before Hajj?
Yeah, we're leaving Monday and I'm seeing him Thursday before.
Thursday before. So maybe if you can get an appointment earlier in the week. Otherwise, I think it should be okay either way because you're gonna go. Yeah, I think either one is fine. You can keep your appointment as is, or you can go for a little bit of an earlier appointment. So at least it gives you a little bit of time.
Okay, and I should continue my walking, right?
Yes. yes, continue walking for sure.
The only thing I want to add to the stretching is please make sure that your knee is straight even when you're using the night splint. Because if your knee is bent and you're trying to stretch, it's not going to be as good of a stretch because that calf muscle starts above the knee. So just be mindful of, how you're doing the stretching.
Okay. Thank you.
Okay, Sayed is next.
Assalamu alaikum. Someone I know mentioned using moleskin patches to prevent blisters. Is that a good idea? And if so, how should we use those?
So it depends on where you're using it. Moleskin patch can be used. For men, I would say probably the most highly irritant area for you, it's going to be between the first and the second toe. So kind of wrapping it around like a Band-Aid would work. For other people, putting it like in the back of the heel, that would be another spot. But if your shoes are well broken in, you probably don't need moleskin. But it doesn't hurt to have like a small piece on hand.
Yeah. I think that Arwa mentioned this as well in her presentation, but when I spoke to her, we actually both wore the same kind of shoe at Hajj. The Ufu's recovery sandal, I would say when I wore that, even though I actually didn't get a chance to break them in too much, although I don't recommend that, definitely break in your shoes. But those caused me like 0 blisters, and I had gone to Umrah twice before, and at those times, like I wore kind of like random shoes, and I got a lot of blisters. But the Ufu's recovery sandal specifically, I think is very good for preventing blisters, because I didn't even have blisters like when I wore those. And that's also linked in some of the links that we're going to send out.
Thank you.
Yeah.
Noman? Noman, you can unmute yourself and ask your question. Okay. If not, Usma, you can go ahead.
Sorry. Oh, there. Do you hear me?
Yeah, go ahead.
I have a question that if anybody wants to during the ihram, can he wear the knee braces?
I think that's a question for a scholar. Personally, I don't think you can.
Okay.
Because you're just supposed to have the piece of cloth on and nothing else. But yeah, I would definitely ask someone else.
I would ask a scholar for sure.
Yeah.
Okay, but the last there was in the chat especially with the brothers, somebody said that if you wear only the clothes is exception for the not the exception. There should not be any stretches. But that they talk about sandals and sandals that they can wear it, but still it has some stretches. So some brothers say no, it is allowed. So you guys have cleared that part during this conversation.
Whether the sandals are stitched or not.
Yes.
I'm sorry, I didn't understand the question.
Means if the sandal has stitches, is it okay or no?
Yes. All sandals nowadays they are stitched.
Okay.
So yes, that's fine.
It's
just, anything outside of that. Because even at the time of Prophet ﷺ, they had to have the sandal, it was stitched to some extent.
What about the mask?
These are fake questions, so I feel like we're not qualified to answer these. I would urge you to ask a scholar. But mask is generally not allowed. Wearing a hat or anything like that is generally not allowed either. But you can use an umbrella.
Okay, so it is not allowed.
Brother, questions like this are answered in a lot of groups where you have muftis. They are doctors, so just ask about problems with your walking and stuff like that.
Okay, thank you, brother, for clarifying. Okay, barakallah khair. Thank you, sister.
No problem.
Thank you.
Can I go now?
Yes.
Assalamu alaikum. So I just wanted to ask, I've had this condition on and off, but I've noticed that it's happening a lot these days where suddenly my feet, the fingers, they freeze and they stick together, and I'm unable to move, and I have to wait 5-10 minutes, and then the sensation comes back, and then I can start walking again. Do you kind of understand what I'm referring to?
Yeah.
Yeah, it makes sense. So it's hard to say because I didn't do like a physical exam or anything, but just from the symptoms that you're describing, it sounds like it could be consistent with rheumatoid. I would urge you to see a podiatrist and then possibly a rheumatologist. It really depends on like what they're seeing and what your symptoms are around that time. But like morning stiffness, especially can be consistent with rheumatoid arthritis. But I haven't seen like your labs or anything along that line, so it's hard for me to diagnose that right, online. But that is like what those symptoms are consistent with.
But this is not like a morning thing. Like it can happen in the evening. Like I went for the groceries 2 days ago, and
Right.
I just couldn't move. It was the evening,
Yeah.
and the pain would sometimes be even up to my calves.
Okay. Wow. Yeah. So I mean, just the stiffness in general, it sounds like a systemic inflammatory disease. So that's something that would need to be worked up a little bit further. Like I said, I would urge you to see a podiatrist before you go for Hajj.
Okay, Jazakallah khair.
No problem.
I think Saida is next, or Hamid. Hamid, you can go ahead.
Hello, Assalamu alaikum.
Walaikum salam.
Sisters, thank you for organizing this. So recently, for the past 1 month, I'm having a lot of foot pain behind my second and third toe. It seems like some people said it could be metatarsalgia. I'm sorry if I'm pronouncing it incorrectly. What do you suggest? Because I'm really afraid, like, even if I'm walking in my home or like just regular walking is causing pain. Forget Hajj walking, like going to the bathroom, going to kitchen, standing. I tried different shoes. I tried Hoka, I tried On Cloud, I tried New Balance. Like I tried different shoes to see if it's a shoe problem. Nothing is resolving. I tried doing the oje, what is that thing called, that round thing, and you lacrosse ball. I did the lacrosse ball stretches. I did other stretches. Nothing is helping.
So I had a slide on this because this is a common issue. I would say if this is something
Sorry,
you're currently
joint
dealing with, no, that's okay. So if you're currently dealing with, I would say it's probably a good idea to see a podiatrist before you go and get an x-ray, because sometimes you can have a stress fracture of like a bone as well that can present with similar symptoms. So you want to make sure it's not that. Sometimes you do need like a steroid pack just to calm down the inflammation a little bit more. Otherwise, these are some of the modifications. This is called a metatarsal pad. You can buy these on Amazon, and you put this behind the ball of the foot to take some of that pressure off this area. But again, it sounds like you have been dealing with this already. It's not getting any better with everything you're doing at home. So I would personally say see a podiatrist before you go, because it might just get really bad during Hajj, and then you don't have a lot of options then.
Okay, Jazakallah. Thank you so much.
No problem.
Welcome. Hamid.
I'm sorry, you're breaking, sister.
Oh, I was just saying the next person's name.
Sorry. Jazakallah khair.
Salam, thank you for this presentation. I just had a quick question about people with flat feet. I was wondering if you have any recommendations for them, specifically when we're going barefoot, like during Tawaf and Sa'i. Like, I know I'm a woman, so I'm gonna have socks. Are there like specific socks I can wear that would help me maybe with that? Do you have any recommendations?
For barefoot, not necessarily, but something that we went over, I think Arwa had a slide on the power steps. Those tend to be really helpful for flat-footed patients. With power steps specifically, people tend to find these inserts kind of hard, so I would urge you to try to break them in. You can wear them for like 2 hours the first day, 4 hours the next day, and then like 8 hours the day after that. So try to break these in before you go. And then, as a female, I'm not a scholar, but from what I understand, you can wear shoes like during the tawaf. So if this is something that you might want to stick into your shoes, that would be helpful with flat feet.
Yeah, there's honestly not much you can do walking barefoot with flat feet. Those socks and stuff you see on Amazon, they don't really do anything. I would probably keep a clean pair of slippers in your backpack that, if you don't feel comfortable wearing like a big tennis shoe, you can at least wear like a supportive slipper during Tawaf and Sa'i. That would provide some support. And that's going to be better than walking barefoot. Because it can feel very long if you don't have something supportive on your feet. So please don't make this harder for yourself than it needs to be.
Agreed.
Thank you. Just one more. What if I was thinking like those cushioned soled socks or the non-grippy socks? I know, do you think that would help or?
So with supportive gear in general, I think a lot of people tend to go for like very like soft feeling, whether it's like an insert or like, the socks that you're describing, because it feels nice like when you have it on, but actually like the harder your supports are or the more stiff they are, it actually provides you more support. So, I mean, I haven't, seen these socks, so I can't recommend them, but just typically with supportive gear in general, the stiffer it is, you actually end up doing a little bit better because you're putting more pressure on that support than you are like on your feet, if that makes sense. So
yeah, I think I know which cushion socks that you're talking about. They're just like heel cushions you can put on. It kind of like wraps the heel. It more so is going to help if you like have a spur. Actually, it's not really going to help if you have flat feet. Like Abir said, it may feel like good just in the moment, but if you're walking like 2 miles in that in the haram, it's not really going to do a whole lot for your feet.
Okay, thank you so much.
no
You're
problem.
welcome. Sabiha.
Assalamualaikum. So I actually got some Hoka Infinity sandals and Hoka recovery sandals. The white ones they're very comfortable. They're very nice. I have my old Hokas that I wear everywhere. They're black. First, I was wondering if that's a problem in the heat or it won't matter in the end. And secondly, everybody is saying, oh, make sure you're able to go in and out of your shoes so quickly. So like, how am I going to have time to tie those hookahs or should I like wear sandals to the haram and then change into the hookahs? So I'm kind of worried about the logistics of it too.
I personally, I wear hokas throughout the year. They are good for about a year. So I feel like if you've already had them, just make sure they're still supportive enough for you. And then, I mean, you can take a minute to tie your laces. Or I feel like those hokas, you don't need to untie them fully every time you put them back on. Hoka is a wonderful shoe, so that's something you're comfortable with. I would wear that. If you want to keep your ufus or your Hoka slides in your backpack, which also you cannot take a big backpack inside haram. It can only be the string backpacks. So make sure it's something compact you can keep these shoe gear in. You can easily switch back and forth in them.
Should I buy like lighter color new hookahs, like to have
No, it doesn't matter. No, because I mean,
Okay.
you wear black abayas there all the time too. So
Yeah.
it's not going to make a difference. Keep the shoes that you have. That's totally fine.
And you said only 1 year. Should I, for that reason, buy some and break some in now? Or if I'm okay with them, they're fine?
If they're still supportive enough for you that you're not getting foot pain, you can continue wearing them. But because for most people, they last for about a year if you're wearing them all the time. So, but if they're working fine, no, you don't need to get new shoes.
Okay. Okay. Thank you so much.
So, Master Bean is next.
Assalamualaikum. I have plantar fasciitis, and that sort of kind of started after my first pregnancy, and my shoe size increased. So it's like my entire foot sort of the bones relaxed. And what I experience now here and there, like whenever it is inflamed, like it's really angry, I have pain in the arch area as well as on the top of my foot. And now my toes, the bones, and I've noticed like if I do more than like yesterday I did like 2.5 mile walk. I was in a lot of pain, and I wore like a shoe brace. It's like a kind of like a not a brace, but it's like a sock that covers the heel and goes all the way to the arch area, and that does help. But if I do a lot of walking, I start feeling the pain. My question is like, I noticed with Birkenstock, I've gotten those shoes because it has really good arch support. It really helps. And then I've been hearing about UFOs. I ordered those sandals. What else can I do to just, make the pain a little um more manageable? Is there anything else I could do, like wear maybe a heel brace or something, and then wear my tennis shoes or something like that? What would you recommend? What are like the must-haves for something like that?
So the must-have, I would say, are going to be a good supportive shoe. A tennis shoe is always better than a sandal, especially if you're walking long distance. Like I said earlier, your toes are grasping the ground and they're gripping it, and coupling that with dehydration. That doesn't work well. So make sure you have like the power step insert, as Abir mentioned. Something soft may feel good temporarily, but that's not really good for the foot. Especially, it's more lax. It's like with pregnancy, you need that firm arch support in there. So as much as you can, wearing your Hokas, Asics, any of those tennis shoes with some inserts is going to be better. Do you have anything else, Abir?
Yeah, everything that Arwa said is helpful. I would urge you to try to do the stretching exercises that we went over, the towel stretches. That's really a lot of where your plantar fasciitis, that heel pain, is coming from. And sometimes it's hard to do these stretches if you have some acute inflammation. If your heel is already hurting, you're not going to want to do these. So like try to take some NSAIDs like ibuprofen, things like that. And then also something that's like a great natural anti-inflammatory that people tend to forget about is just ice. Like if you ice your heel for 20 minutes on, 20 minutes off, and then try to do these stretches. And it's recommended that you do these stretches about 4 times a day. So I think you're doing everything when it comes to shoe inserts and like wearing supportive shoes, and like UFOs are great. It's great that you order those. But just like the day-to-day, just helping what is actually like causing your heel pain will definitely I think do well for you, since you do have like a little bit of time before Hajj. So reduce the inflammation and just start doing those stretching exercises as much as you can.
Jazakallah. Thank you.
No problem.
Nada is next.
Thank you. I posted a link for compression stockings in the chat. Would you recommend that, or do you have any recommendations for us to buy? And then the links that you said you would share with us, how would you share those?
I will post the the presentation in the comments. And at the end of the presentation, I had this slide. Let me see. There we go. And these links are clickable. I did have one for compression socks as well. I'm pulling up the ones. Oh, that's the night's one, sorry. I'm not very good.
I'm from the phone, so I can't seem to click them, but I guess because you're just sharing.
Oh, the link that I'm getting is for the night's blend. Are you able to open the compression socks one?
No, it keeps linking me to a night splint. Now the link that you sent, that like takes me to a night splint, not a compression sock.
Any compression sock is fine as long as it includes the toes. So make sure you're not getting the ones that cut out the toes, and it should come to below the knee. Anything shorter is not good. And then, like I said, make sure you measure your calf size so you get the right size of compression sock. So medium, large, whatever that is. And then the other number is the 15 to 20 or 10 to 15. That's a level of compression. The 10 to 15 is probably the lightest, and that's good for everyday walking. If you can tolerate the 15 to 20, that's going to be the most beneficial. The 20 to 30 is more so for people who have chronic conditions.
Yeah, I see this in the chat, and this is a good idea. If anyone wants like these links, just send an email to podiatrynetwork@gmail.com, and then we'll send you this presentation and the links in it. So you'll have that.
Can you please post that link on a chat? I mean, email address.
It's on the chat. It's muslimpodiatrynetwork@gmail.com, but I'll copy and paste it for you. Oh, there we go.
Yeah, Ali just posted the link. Okay. We have about 10 more minutes. Rasul next.
Assalamu alaikum. Thank you for taking my question. How do you prevent your feet from swelling up on the long flight to Hajj? Thank you.
That's the compression sock. That's what it prevents the swelling. I think everyone in your family, whether you're young, old, everyone should have compression socks. Put them on at the beginning of your travel. Take them off whenever you land. That's going to prevent swelling the most.
Thank you.
And even like getting up and walking around if you can, like during the flight itself, especially the longer haul flights. If you can just get up and just like take a quick walk, that would be good while you're wearing the compression stockings. But yeah, both of those things would prevent swelling.
Okay. Thank you so much.
Yeah.
Sabahat?
Assalamualaikum. Jazakallah for doing this. So my question is, I do get blisters when I walk a lot. So I was planning on wrapping it up with the tape, and I just saw in the chat that's not a great idea. So what is it we can do to prevent it?
Abir, you want to answer?
Sure. Like for me, I think I mentioned this a little bit, but that UFU's recovery slide really saved me. It's pretty like friction free. And then there's a balm that I think Arwa also mentioned in her presentation or in one of her slides. Those two things will, help prevent blisters. Yeah, it's not recommended that you apply tape directly to your foot. It can be quite harsh on your skin, and it can actually cause more problems than fix them. If you do end up getting a blister, I would say, just try to prevent that blister from popping. Like just let it just kind of resolve on its own, because the roof of the blister actually acts as like a natural band-aid. So if you do end up getting a blister, like it's okay to maybe like apply a band-aid like over the blister, but I wouldn't apply anything directly to your skin other than maybe the balm. And I think the UFU's recovery sandal is actually like a pretty big game changer when it comes to blisters.
Yeah, most common reason you are getting blisters is because of improperly fitting shoes, and if they're not adequately broken in. So if you start with those two things and then add in that body glide, that should prevent them. But yeah.
Thank you.
Sayed is next.
Salam. I have a question. If a patient is on, or a person is on blood thinners and is diabetic, and they get a foot ulcer or something, get a cut, how can we stop the bleeding? And what to do to prevent the infection? Can we take antibiotic from the doctor prophylactically?
So I would say basic wound care, right? Like oral antibiotics may not be indicated for like a small wound or a cut that's pretty clean. Just try to clean it up the best that you can, and then apply an antibiotic ointment, and then keep it covered with either gauze and paper tape, not like the surgical tape, but there's a specific tape called paper tape that can be applied directly to the skin. Or if you're in a bind, like you can cover it with a Band-Aid. The two big things are keeping it clean, applying like an antibiotic ointment, and then just keeping it covered so it doesn't, it prevents like anything from any of the bacteria from getting in. And then there are medical tents, I believe, there. So if you need anything like bigger than that, if you notice a lot of cellulitis that's like ascending, that's going up, a lot of like redness, swelling, if you notice like pus coming out or any color drainage, I would say try to go to a medical tent and see if they can help you with antibiotics, or if you need anything further along that time. Was there a second question that you said?
If a patient is on blood thinner, same thing you answer, I think gauze and paper tape.
Right. So for preventing, that person from bleeding out, just holding a lot of pressure can actually help stopping like that blood and elevating the foot. So try to elevate above the level of your heart, have them lie completely flat, and then put 2 pillows under the foot that's bleeding and elevate above the level of your heart, and then have somebody hold a lot of pressure to the cut. And those 2 things should help.
Thank you.
No problem.
Mrs. Naz is next.
Yeah, Assalamu alaikum. Thank you for the wonderful presentation. So my question is like, so which is better, the shoe, the covered shoe, or a sandal, or we should keep both of them?
Personally, I would say the covered shoe, a tennis shoe. I think it's always better than a sandal.
Okay. Okay. Thank you.
Abir, did you have a different idea?
Agree.
Yeah. Rania is next. Rania, you can unmute yourself and ask your question. Maybe she's not there. Last couple of minutes, anyone else has anything else? Let me look at the chat box really quick, make sure I didn't miss anything. Sana Molson asked, she has lower back pain and knee pain, but she never went to a podiatrist to check on the shoes. Any recommendations for shoes with these type of issues? So back pain and knee pain. Do you have anything you recommend, Abir?
I think all of the shoes that I think Arwa, you have some linked, those are fine. Asics, Hoka's, those are pretty good. Orthopedic shoes. For back and knee pain, if it's like radiating to your hip, I would say maybe just rule out sciatica. That's something that it's like a nerve. It's like a nerve type of pain. So that's something that you might need like a little bit of a further workup for. Like it might not just resolve, based on your shoes. But yeah, all of the shoes that were mentioned in the presentation are pretty good. Asics, Hoka's are pretty good shoes. Yeah.
Second question is basically what you just said. They said for sciatica pain that goes from the lower back to the knee and the foot. Are any specific braces or other things that you could recommend?
Yeah, for sciatica, that's more like hip and back pain. So that's something that might like have to be addressed like further by an orthopedic. Because it's a lot of it is like radiating from your back and your hip.
Yeah, if that's something you're currently dealing with, I would definitely see a provider before you go.
Yes.
Just wearing certain kind of shoes not going to relieve your sciatica pain.
Right.
And then
agree.
Ali did post the YouTube link where this presentation is going to be available. Uzma, what's your
Jazakallah. So if I plan to wear the Ufu's recovery during the Tawaf and Sa'i, and the Hokas during the rest of the days, the Hajj days and the other days, is that a good plan?
Yes, I think so.
Agreed.
Jazakallah.
Abdul?
Assalamu alaikum, and thank you for the presentation. My question is, I may have missed it, but how many miles do you recommend to walk before the Hajj, every day? And also, do we need to walk with the flip-flops, or we can walk with the regular shoe, sneakers?
I would
Thank
say
you.
try to walk in the shoes that you're going to use, like during Hajj. There isn't like a specific recommendation that comes to mind of how much you should be walking, but let's say me and my husband would walk for like an hour a day before Hajj. But even that I felt like was not enough for me. I would say just as much as you can tolerate, and try to wear the shoes that you would wear like when you're at Hajj. So you get used to those and you break them in. You're doing 2 things at once. You're practicing walking and you're able to break in the shoes.
Okay, thank you.
No
Yeah, just don't go from like 0 to 100. If currently you're walking like only 10 minutes, don't try to walk an hour the next day. Just slowly try to build it up. And the more you can do, it's only gonna be helpful. There's no such thing as too much practice walking before Hajj. Sayed Mushtaba is next.
Assalamu alaikum. So I have this toe fungus issue. So I was wondering, since we are supposed to keep it exposed, so you think it will get worse or get better in the heat and over there?
So fungus kind of thrives in environments that are dark and moist, like inside your shoes. So if you're wearing open-toed shoes, I really don't see like why it would get worse. But if I would recommend that you treat the fungus the best that you can before you go. You can use like clotrimazole cream. A lot of this stuff is like over the counter now. So just like any antifungal cream, you can apply to your nail. There's a cyclopurox solution. It's like a nail solution that you can use for your fungus. It tends to be a little bit pricier. And I haven't really seen better results with the solution versus the cream. If you apply the cream to like your cuticle area, like this area of your toe, like that tends to help people. So you can try something along that line. But I mean, I don't see why it would necessarily get worse. Yeah, no problem.
Yeah, I wouldn't worry about toenail fungus while you're there. It's not really gonna get worse, or it's not gonna be, it's not something acute. It's something you're probably dealing with right now. You can even treat it whenever you come back long term. It's not gonna improve right away. So, yeah, I think that's all the questions, and the time is up. Jazakallah khair so much for joining in. For all those going for Hajj, may Allah accept your Hajj. Keep us in your du'as as well. We will try to get all the resources to you as much as we can. Like Ali said, it's going to be available on YouTube, this whole presentation, and the links are available at the end. I'll see if I can just post the links directly on here too. Anything, Abir?
All right. Well, thank you all for joining us. I hope we were able to answer most of your questions. And yeah, may Allah subhanahu wa ta'ala accept your Hajj and keep us in your du'as, inshallah.
Thank you very much. Assalamu alaikum.
Jazakallah, sisters.
Alaikum assalam. You can always just email your questions to that Muslim Podiatry Network, and we can always answer them at a later time as well. I can post my email in the comments. If you have anything, you can always feel free to message me directly as well.
Yeah, I'll post mine too.
Okay. I think I should be able to share this copy in here.